that you're watching this video makes me very happy because it means I get the opportunity to introduce myself to you as well as my business. My name is Carmen. I am your myofunctional therapist extraordinaire, and I am obsessed with all things myofunctional therapy, tongue ties, wellness, and helping you navigate through this messy to magical journey called myofunctional therapy. I found this path of passion years ago as a veteran dental hygienist. I loved seeing my patients. I hated scraping teeth, so it was time for a change. So I did some advanced training in myofunctional therapy, and then I decided to make a career pivot. My story is personal and close to home. It starts with my sweet granddaughter, Lindsay, who for years had been passed back and forth amongst doctors and therapists, trying to figure out her speech and her breathing and her sleep and chewing and swallowing issues. It wasn't until I completed my therapy training that I knew her problem was what I suspected. It was a big old nasty tongue tie. So if you fast forward to now, I am a crusader. I'm a warrior. I'm a voice for those who can't find theirs or who don't have one. Most of the time, that's children, because they don't know any different and parents have maybe been misinformed or they didn't know that any of these things were concerning. So I see clients all over the world, and I work to provide innovative virtual therapy in the remotest of places. So I'm really excited that I can bring this therapy to people who otherwise would not be able to get it. So what is the IMT difference? IMT stands for Integrative Myofunctional Therapy. That's my business, that's my baby. So what is the IMT difference? Here in my business, our core focus is you. You're the hero here, and so first I say hugs and high fives to you for caring enough to know that something's wrong, to caring enough to know that you need to make a change, and to know that you have the power. You've got the want to see yourself breathing better, eating better, chewing better, swallowing better, free from sleep concerns, digestive highs and lows, and speech troubles. So you are the superhero. We're just the cape. We're just here to help you out. Working with integrative myofunctional therapy is not about price. It's about the unique myofunctional experience. And that's the real reason that people work with us. Quite honestly, I think price is just a small part of the big equation, and I don't think it should ever be used as the deciding factor if you're considering making changes for the long term. Not only do we deliver innovative, effective therapy through a variety of programs, but our proven process, my meticulous framework, success stories, and unparalleled success support, customer service, put you in the driver's seat to experience a life-changing new normal. So what can you expect when you work with us? First of all, we get your truth story. Why are you here? We help you understand what your current status is and help you get clarity about where you want to be a year from now and why. So I want you to help point your ship for me so that I understand, because fuzzy targets don't get hit. So it's really important for you to know why this is important, what changes you want to make, what your goals for therapy are. And I don't want this for you more than you want it for you. So that's the big thing. So we make an accountability pact with you. We promise to deliver efficient and effective programs. We're going to deliver that effective and efficiently to you. I'm going to give you programs that are organized and clear, and the work I do with you is going to be impactful. And the biggest thing, my friend, is that unparalleled success support. I, round the clock, am helping my clients be successful. You promise, on the other hand, to bring grace and to bring patience and perseverance, to take massive action, to practice, and really to give it that old A-team effort, because that is so very important. So as you explore my website, you're going to learn about programs. There's videos that talks about them. There's prices, there's payment plans, all of that stuff. Remember, I don't want you focused solely on price. I want you to think about A, personality match. Do I seem like somebody that you would look forward to working with or seeing our schedule on the calendar. I want you to consider how you learn best. That's the most important thing. So I'm going to take a moment and answer some frequently asked questions, because rather than hit email or hit reply on an email, I would much rather send a video that I feel like is more personable. So the first question is, how do I decide which program is best? So I just got done saying, I think it's important that you think about how you learn best. If you know that you need to have your hand held, then you need to do a program that's definitely going to do that. If you have advanced needs, that's going to be something different. If you're concerned about doing everything right versus taking shortcuts, those are things that are really important to think about. When it comes to our different programs, if time or location or money are barriers for you, then there's options for that. At the end of the day, the best option for you is the program that you will complete, okay? I will always give you my best opinion on what I think is best for you, but it doesn't matter what I say if you're not going to finish it. So that's the biggest thing. The best program for you is one that you are going to finish. All right, the next question is, how much are sessions? Do you offer one session at a time? Because I know the benefit of providing complete care or comprehensive care, I do not offer piecemeal therapy. Let's face it, a lot of people don't finish what they start. And I have found that if I teach in a program format and don't offer individual sessions, that is going to help push you to the finish line. And again, wellness, improved wellness is my goal, okay? And then I have also found that everything I teach is built on a building block. So it's built on the step before, and so it builds on each other. And so if I do not have a clear path from A to Z, then it gets a little bit easier for you to drop out of therapy. So at the end of the day, I really look at my packages as an investment in your wellness. And so I do it just as a package rather than an individual session. The next question, do you accept insurance? Unfortunately, I don't. And I'm going to be straight up with you. We all know that insurance is a pain in the butt. It takes a ton of time to get anywhere. It's very frustrating. There's a lot of hoops to jump through, and I just don't have the manpower to do it. And I don't really want to have the manpower to do it. My focus is on providing you the best therapy, the best experience without being told how to run my business. And unfortunately, when you let insurance in the door, they start to tell you how you can and can't run your business. And how to do everything. So that it matters to me that I get to do what I think is best for you. Insurance is not a nonprofit business, and insurance companies do not have your health and wellness as a priority. It's all business to them. So that really matters to me. So I just do my best to keep my prices affordable and have different payment plans, different programs, and hope that that's going to make it possible for you. It's worked for me for years for this, or doing it this way. For somebody who is very insurance driven or only focused on cost, I encourage you to focus on finding somebody who you know, like, and trust, and then let the money stuff figure it out, okay? We've had clients use health savings accounts, use flex accounts. Every plan is different, so I'm happy to provide a super bill to try and help you in any way to be able to use your insurance. However, I will not directly bill an insurance. I won't accept any assignment. I won't call an insurance, anything like that. So how do I know if I need myofunctional therapy? This is something we figure out during your comprehensive exam, but a lot of people start with a free assessment. And when we do that, I give you 30 minutes of my time. You send me some information. We talk about your particular situation and make sure that it makes sense for you to move on to a paid exam. I never want somebody to pay for an exam and then me say, hey, I think you're fine. So we always figure that out during an exam. When you do an assessment with me, like I said, you'll fill out some paperwork that's going to identify areas of concern. It's going to highlight some symptoms, and then we're going to use that as the basis for our conversation to talk about you moving forward. Myofunctional therapy focuses on 4 goals of therapy: correct tongue posture, correct mouth posture, nasal breathing, and swallow corrected and normalized. So correct tongue posture is the tongue living tip to tail, so from here to here in the roof of the mouth. Correct mouth posture is mouth closed, lips sealed, and teeth gently together, like about 1 millimeter apart. Your teeth shouldn't ever just be crammed together. Nasal breathing should be the predominant method of breathing, and then swallow correct and normalize, so you're doing it correctly. You're not pursing your lips. You're not chicken necking. You're not washing your food down with water. That you're not chewing, in a hurry and just swallowing, choking, that kind of stuff. So if you have trouble with any of those 4 goals of therapy, then definitely you would benefit from myofunctional therapy. And that really is a great place to start. You also can look on my website. I've got tons of resources. I have a self-assessment tool. You'll find that also in the Getting Started guide. Tons of different parts on my website where you can find different answers to a lot of these questions, and it will really clue you in to whether you have myofunctional concerns or not. I will remind you about this. Tongue ties are not only diagnosed by appearance, they're diagnosed by how they affect the oral function. So while some people have a tongue tie that is what I call low-hanging fruit, not everybody does. So that's why it's important to have a comprehensive exam. If you have a doctor who has told you that you're fine, or there's a mild tongue tie, or you don't need to do anything about it, I caution you to take that with a grain of salt, because until you experience what a comprehensive examination is like, I take pictures, we spend an hour and a half together, you send me videos, I have all of your questions, all of that stuff. I do functional assessments. If you haven't had somebody spend that amount of time with you and they tell you that you don't have a tongue tie, it's quite possible that it's getting overlooked. So great place. You can always start with a free assessment so we can visit and see if it makes sense for you to move forward. I hope this video was helpful. I know it was kind of long-winded, but I wanted to answer these frequently asked questions in a more personal manner rather than just, dashing off an email. If you have questions, you know where to find me, and I am eager to help you in any way that I can.